Welcome back to Healthy Living with Mila. Doctor Talk segment. Don't go wide because we're going to show you the best ophthalmologists in Papua New Guinea from Pacific International Hospital. No other than Dr. Vivek. What a wonderful guy to talk to. He is going to elaborate, emphasize that high sugar level on your blood, on your system can cause blindness. Diabetes sufferer, take note of this. You don't want to lose your eyes. Stay tuned. Listen to Dr. Vivek.
I'm Dr. Vivekaraj Jaraj. I'm the consultant ophthalmologist at Pacific International Hospital. Today I will just describe about the anatomy of the eye, the basic structure of the eyeball. So as you can see here in the picture, the basic anatomy of the eye, it looks like this. The outermost portion is covered by a thick white colored area layer, it's called sclera, and deeper to that we have got choroid, which is a brown lining, and still deeper to that is retina. Retina is a transparent, a thin layer which has got very important functions for vision. This is where the images are formed. And it has got a lot of blood vessels there in it and a lot of nerve fibers. Retina can be affected by diabetes silently, gradually, and it can lead to blindness as well. I told you retina has got a lot of delicate blood vessels in it. So this can be attacked by diabetes. So slowly the blood vessels can get damaged and fluid can start leaking from it. And it can be deposited on the retinal surface and block the vision. During this process, there is absolutely no symptoms. And the next stage will be blocking of blood flow in various areas of the retina. When that happens, the tissue divide of oxygen suffers without oxygen and glucose, that is called ischemia. So when ischemia develops in the area of the retina, it leads to release of dangerous chemicals which trigger formation of new blood vessels on the retina. These new vessels are dangerous because they are very fragile and easily can rupture to produce profuse bleeding into the eye cavity. So when that happens, the retinopathy stage is very advanced and the patient loses vision instantly, immediately. So these are the various stages of diabetic retinopathy, which means the damage that happens to the retina due to diabetes. So every diabetic patient needs to be examined every year without fail for a detailed retina evaluation. Because if it is detected in the early stage, it is easily treatable by means of laser and by means of some injections. But if it goes to the advanced stage, it's really difficult to treat and it can lead to blindness as well. The only prevention from going blind is periodic regular examination with an ophthalmologist. That is the only way we can prevent visual loss, because many of these conditions are silent. Unless we are examined, it's going to miss easily. So especially diabetic individuals. So the recent research reveals that 5% of people are blind in PNG and 8% of people above age 50, they have diabetes. And of them, 80% of people, they have never subjected to eye examination so far. And nearly 50% of them, they have some form of diabetic retinopathy at the moment in the eyes. So which shows the lack of awareness as well as the silent nature of the disease. So only by regular eye checkup by a retina specialist or an ophthalmologist only can prevent visual loss in diabetic patients. This instrument is called slit lamp, and this is a basic tool for examination of eyes. It gives the optical cut section of each layer of the eye structures in the front portion. So this is an indispensable tool for diagnosis as well as prognosis of treating various eye conditions. And we have also got a camera attached to it to capture clinically relevant conditions, the pictures. And with this machine we can also check the eye pressure by means of applanation tonometer, and also we can do other procedures like gonioscopy or foreign body removal and all that. So this comes very handy in the diagnosis and treatment of various eye conditions. And this one little lens is called 78 diopter lens. It helps in examination of retina, the back portion of the eye. There are various structures there: optic nerve, retina, vitreous cavity. So all those structures will be viewed better with this using this small lens there. Now let me show you the laser machine that we have got in PIH. Yeah, you can come with me. So this is the laser machine that we have got here. This is called diode laser machine. It helps in diabetic retinopathy treatment. It helps in reabsorption of fluid, whatever is accumulated in the retina, so that visual recovery is possible. And also it prevents formation of new blood vessels in the abnormal areas of the retina to prevent sudden visual loss. So it helps in various ways, and also it is useful to treat the peripheral retinal holes, which can later lead to retinal detachment. So the B-scan helps in assessing the deeper structures of the eye. Sometimes when we have dense cataract or anything obscuring in the front portion of the eyeball, we cannot view the back portion of the eye. So to be able to assess the complete inner structures of the eyeball, this B-scan is really helpful. So this is the lens. This is the cornea, the front portion of the eye. This is the nerve which is going in, and this is the retina. This is the cavity inside. So this cavity is empty, which means it's normal. Okay. Yeah. So in conditions where there is some pathology, there will be shadows here in this cavity. Oh. Yeah. In retinal detachment, you see a lining going in. So all that. So basically, it's perfectly normal eye. Yeah, the lens is nicely seen. So it's good. Okay, so these are some of the machines that we have got in Pacific International Hospital, and you are more than welcome to visit here, and we are happy to give you comprehensive eye care and also help you protect your vision lifelong from dangerous diseases like diabetic retinopathy and cataract and all the other illnesses. So blood sugar control is very important in preventing visual loss due to diabetic retinopathy, and as I have explained to you earlier, the visual loss can be silent and sudden and total. So to avoid permanent blindness due to diabetic damage, it's very important that we should keep very good blood sugar control all the time. So to achieve that good control of blood sugar, exercises are very important. And we have got some very good exercise tips for you from Mila. Over to Mila now.